As always, let's start off with a case. A 46-year-old male with type 2 diabetes develops a liver abscess that requires a long-standing drain. He is on cefpodoxime and metronidazole. So my question for everyone is, which of the following is a dose-dependent effect of metronidazole? Is it a disulfiram-like reaction, peripheral neuropathy, urine discoloration, or a metallic taste? So the answer is peripheral neuropathy. So today we're going to dive into all the different side effects of metronidazole. Here's an obligatory molecular structure of metronidazole, and the trade name is flagyl. As a reminder to everyone, this is an antibiotic and antiprotozoal agent. So you will see metronidazole generally used for anaerobes, BV, trichomoniasis, giardiasis, and C. diff. So here are the side effects that we will be talking about. Disulfiram-like reaction, question mark, metallic taste, urine discoloration, and finally, peripheral neuropathy. So the first is disulfiram-like reaction. So you may have been taught this classically. In alcohol use, disulfiram inhibits aldehyde dehydrogenase. And so you get an elevated acetaldehyde concentration. So you feel pretty bad. And there was some description that metronidazole would cause this reaction. However, this has really been debunked multiple times. So it's not really a thing. So I would be very cautious about attributing this particular feeling to metronidazole. If someone has what you suspect is a disulfiram-like reaction in the setting of metronidazole, it's not what it is. So don't anchor on that. Something else might be going on, so try and investigate that instead. Next, we have a metallic taste. The incidence rate is important because it really deters patients from completing their antibiotic regimen. So it's more common than we think. So it's really important for us to counsel our patients and say, you might expect to have a metallic taste. Please remember it's just from the metronidazole, and that is not a reason to stop taking the antibiotic. Of note, there's this meta-analysis that compares tinidazole to metronidazole, which is in the same class, and tinidazole has a higher incidence of metallic taste. So if you have the option of choosing between the two, pick metronidazole. If you don't have the option, let your patient know that if they are taking tinidazole, they're really probably going to have that metallic taste in their mouth. The next thing is urine discoloration or darkening. So when you're counseling patients on metronidazole, you have to let them know about the metallic taste in their mouth, but also that the color of their urine might change. And the color of their urine changes because there's a metabolite of metronidazole that causes this change. Finally, we'll talk about peripheral neuropathy. So the overall incidence of peripheral neuropathy isn't really known. If you reflect on some of the cases that you've had in the past and someone is on metronidazole for an abscess that was drained or a pretty big infection, you often see the duration of the treatment to be 4 to 6 weeks. And part of that is because metronidazole-associated peripheral neuropathy is seen with greater than 42 grams of total drug administration. And so that often is about 4 to 6 weeks of treatment. What is great is that symptoms resolve after discontinuation of therapy in most patients. So it really behooves us to counsel our patients on this, but also realize it's our job not to give too long of a course because we wouldn't want to cause peripheral neuropathy. So finally, to review all the side effects of metronidazole, a disulfiram-like reaction is not really a thing, so we have to be really careful. If someone is feeling unwell, do not attribute it to metronidazole. Do not prematurely close on that. The metallic taste can affect medication adherence, so you have to let your patients know about that. The urine can get discolored, so we have to tell our patients that it really has of no clinical consequence, but it might happen. And finally, peripheral neuropathy is usually seen with greater than 42 grams of total drug, which is about 4 to 6 weeks of treatment.